Hello everybody, welcome to UroChannel. A few weeks ago, a patient came to my office for the first time. He was in his 50s and complained of issues with his prostate. He told me that he used to be called the man with the bladder of steel because he never had to go to the bathroom. Now he had to go every hour with a strong desire to void, but the volumes he was voiding each time were quite small. And this continued even throughout the night. The examination revealed that the condition of his prostate wasn't actually that bad. It was only slightly enlarged. He could empty his bladder quite well, so residual urine didn't seem to be the problem. Upon ultrasound, there was no obvious sign of cancer in the bladder either, so I started to look at his urine. And here's where I found the reason for his problems. No signs of urinary infection, but copious amounts of sugar and protein upon dipstick test. A blood sample revealed that he was indeed suffering from diabetes, something he wasn't aware of. I am telling you this story to remind you that the prostate is not always the bad boy. Men have learned that the prostate enlarges with age and then compresses bladder outflow, which will cause a weak urinary stream, nocturia, incomplete bladder emptying, and all these uncomfortable symptoms which urologists summarize as LUTS, lower urinary tract symptoms. The prostate might indeed be the problem, but LUTS has many reasons. One of them is diabetes. And diabetes is one of the most common diseases there is. The National Diabetes Statistics Report of the CDC for 2020 reveals alarming numbers. Overall, 13 out of 100 Americans suffer from diabetes. In the age group 65 and older, it is roughly 27 out of 100. These numbers include men and women. So attention all you women who watch this video, if you have diabetes, you might experience LUTS as well. Diabetes is often taken too lightly. I mean, cancer, what a name, gets everybody trembling. But diabetes? And it doesn't hurt either. But diabetes is the master destroyer. It destroys nerves and small blood vessels in the whole body. Here's what it does to the bladder. In the early stages, it causes bladder overactivity in more than half of the patients. Bladder overactivity is characterized by a sudden compelling desire to void that is difficult to defer. What you feel is the bladder muscle contracting. It can be very powerful. A pressure of 120 centimeters water column is possible, and this is something that no sphincter will be able to hold. When it happens and no bathroom is within reach, urinary incontinence might happen. Additionally, diabetes makes you drink more, and consequently, more urine is produced, which also contributes to more frequent visits to the bathroom. With time, bladder tissue will get damaged and toxic metabolites accumulate in the bladder wall, which then leads to the classic problems of the diabetic bladder. These are a loss of sensitivity and advancing loss of contractility. So you start to lose the feeling of bladder filling and when you have to go to the bathroom. Additionally, the bladder muscle loses its strength and contractility. Residual urine is the consequence. It may reach quite considerable amounts, resulting in bladder over-distension, leading to even more residual urine, and eventually loss of bladder function. The bladder will then be completely full at any time and then start to leak, something that is called overflow incontinence. Other symptoms include weak stream, difficulty to initiate voiding, dribbling of urine, and incontinence with straining. As you can see, the appearance and severity of symptoms may be highly variable between patients. Since it won't be possible to restore the function of a hyposensitive and hypocontractile bladder, diabetes has to be diagnosed and treated as early as possible. Here is some basic advice what you can do for yourselves. Try to avoid obesity. With increasing body weight, the risk for diabetes increases dramatically. Just to make it clear, I'm talking about type 2 diabetes here, not type 1. Exercise regularly and especially go to the gym and train your muscles. Muscles are not only for movement. During the past years, more and more evidence emerged that muscles are also metabolically active. Regular strength training is able to both lower and stabilize blood sugar levels. It sensitizes the muscles to utilize more sugar from the bloodstream. Because sugar is important for the body. Excess sugar is detrimental. Sugar fuels movement because it is used to produce ATP, adenosine triphosphate, and ATP is what allows muscles to work. Regular training gets even more important as you age because the body will have more and more difficulties to deal with excess sugar in the bloodstream just because of the aging process. As soon as a diagnosis has been established, the disease will have to be treated medically. When blood sugar is back to normal, the symptoms of bladder overactivity will disappear after a while. There are also things that can be done to reduce bladder overactivity from the urologic perspective. Anticholinergics represent a cornerstone of treating overactivity. There are some drawbacks though, as they usually display dose-dependent side effects. Dry mouth is very bothersome. Obstipation is another one, and in the elderly, one has to be careful as anticholinergics might interfere with cognitive abilities of the brain. During the last 20 years, drugs have been developed to reduce the severity of side effects. But everybody reacts individually, so that sometimes several brands will have to be tried. Since many of my patients are very critical towards anticholinergics, I've tried Tadalafil with good results. And since it is a PDE5 inhibitor, it increases erections as a bonus, which is a good thing, as diabetes also damages erectile function. If you have watched some of my videos, you will know that I am a big fan of shockwave therapy because of its effectiveness in many areas of urology and because it has no side effects. There is now emerging evidence that shockwaves are also effective in bladder overactivity due to diabetes. So this might also be worth trying. If you want to know more about shockwaves, check out this playlist. In bladder underactivity, it is advisable to void regularly because filling sensation is reduced and the bladder might be full without you noticing it. Double voiding will also help to empty the bladder. Double voiding means that you void for a second time 10 to 15 minutes later. Pelvic floor exercise is helpful as well. When it comes to residual urine, as a rule of thumb, I'm kind of willing to accept volumes up to 100 milliliters. But beyond that, and definitely at 200 milliliters residual urine, intermittent self-catheterization will be the thing to do. In these cases, one will have to look closely at the prostate again and remove any obstruction within the lower urinary tract. Pressure flow studies will help in these cases to determine whether the operation of an enlarged prostate might be worth a try to avoid self-catheterization. There is a class of drugs designed to increase bladder muscle strength. They are called cholinomimetic drugs, and they are used quite frequently, at least here in Germany. But I don't use them very often. Most of the time, the clinical effect is disappointing. If you are experiencing trouble with your bladder, don't hesitate to book an appointment with your local urologist. Thanks for watching. Bye-bye. Because it is used to produce ATP. Adenosine, because it is used to produce ATP. Adenosine,